Good afternoon and welcome to our March webinar, a collaboration between Parent Training and Information Center and the Recruitment Training and Support Center at the Federation for Children with Special Needs. My name is Janie Crecco and I am the Training and Support Specialist at RTSC. Our technical producers today are Renee Williams, Sonia Fort, and John Sullivan. Today's webinar is Police Interventions During Behavioral Crisis, a brief history and a look toward the future. My co-presenter is Gwen Healey, Program Coordinator for Pathways for Parents Project. Gwen has worked at the Federation for nearly 16 years. Through the years, she has worked in several projects and now works exclusively in partnership with the Department of Children and Families through the Office of the Ombudsman, providing support and guidance to families who have complex cases involving child protection. Gwen has continued to have a strong interest in promoting effective police interactions with youth who have disabilities and encouraging proactive collaboration between police and families. When Gwen presents her part of the webinar, she will speak a little bit more about her past and how she has worked on special things that we're going to talk about here in this webinar. During the webinar, please type your questions in the toolbox and feel free to engage with other attendees. We will leave time at the end of the hour to address any questions. If your question is not answered live, please send us an email and we will do our best to follow up with you. If you are interested in learning more about the Federation, please go to our website at www.fcsn.org and explore all the different programs, including how to volunteer to become a special education surrogate parent or attend one of the many trainings presented by the Parent Training Information Center. Okay, welcome everyone, and our outcomes today are going to be to review mental health issues in law enforcement and the history since deinstitutionalization, the impact of negative interventions on families and children and adults when they turn negative, and then we will talk about the history of collaboration that has started, especially since the mid-90s. And then Gwen will directly address strategies for families, and her information is very important for, especially for families with kids with disabilities or kids with mental health issues. So a brief history. Deinstitutionalization occurred in the United States during the late 50s, mostly during the 60s. In 1955, there were almost 500,000 patients institutionalized in various places in the United States. When deinstitutionalization occurred, there was an inadequate provision in the community to take care of the people that were leaving the institutions. And that left a void for many purposes, but it also increased tremendously the homeless population. And when the deinstitutionalization occurred, there was no backup support for the people who were deinstitutionalized and did not go home. So many of them, as I said, became homeless or ended up in jail. Mental health reform happened slowly at first, but just to kind of recap the process, what first happened as deinstitutionalization occurred and many people with mental health issues were in the community was due process, especially for adults. And what it came down to was eventually, and if any of you have ever had anybody involved in mental health issues, you can only be hospitalized if you are a danger to yourself or others. Now, that is determined by different criteria, and essentially it means that for 3 days you can be put into a hospital if you appear to be of danger to yourself or others, but then other due process kicks in and you have the right to leave a hospital. But unfortunately, there, as the result of deinstitutionalization, there was an increase in what we call the criminalization of the mentally ill. Reason being, there weren't adequate supports in the community for them when they were sent out of the institutions. And most recently, of course, many of you probably know about the Child Behavioral Health Initiative, which provides community crisis intervention services for kids who are undergoing mental health crises. To continue with the history, the nature of mental health services continues to be very fragmented. The reason being, even though the federal government has combined all services through SAMHSA, in the community itself, it's very fractured. One of the main problems is the co-occurring disorders between substance use and mental health issues. And up until very recently, the co-occurring disorders meant that, for example, if you were actively using, you weren't allowed to go into shelters. And then they created in some cities wet shelters where you could be intoxicated in one way or the other and come into the shelters. But that is pretty recently. So if it was a co-occurring disorder, you were kind of out of luck as far as finding shelter. Managed care, which we all know and love, has also kind of increased the chronicity of mental health issues because they too are fragmented, and substance use rehabilitation is very different than mental health rehabilitation. Different facilities, different approaches, this kind of thing. So it adds to the fragmented nature of the whole process. And then we started doing the Just Say No drug policies back in the 90s. And unfortunately, that did add to the criminalization of mentally ill people. But it is true that drugs can lead to violence. Certain kinds of drugs, in particular PCPs, is that what it is? A lot of the overstimulating drugs can create psychosis in a lot of people, and that can make them appear to be violent to themselves or others. Again, we have those co-occurring disorders. I don't know the actual percentage of people with mental health issues that have comorbid substance use, but it is quite high. So what happened as a result of all of these various policies and the fragmented nature of approaching mental health is that this whole idea of mass incarceration started. 500% increase over the past 30 years, and right now there are over 2.2 million people incarcerated in the United States, far greater than any other Western country. And again, substance use, if you are actively using, and we're seeing this very frequently with the opioid crisis, you could be rejected for services for mental health. And I have not updated this since Gwen and I first presented back in, was it November, I believe, to talk about the opioid crisis. But again, a lot of that is what we're seeing is a defragmentization of services, and where the medical places where many of the, especially for babies that are being born, the moms are now not necessarily arrested for drug use, or the kids are not necessarily taken into care, and they're doing the detox of the babies with the moms in the hospital, so that the mom can also receive services for her problems. So that's a good thing. So zero tolerance police interventions. This was all of the kind of the evolution of what was happening with so many people that were deinstitutionalized. It's now 50 years ago, but we are still feeling its effects. So with all the homeless people that occurred after deinstitutionalization, the gentrification of cities especially in the 80s and 90s, looked at the problem of homelessness as a disturbing the peace and a public nuisance. And I can remember this when I was working in the community in Hyannis. Many homeless people in Hyannis, and the main street in Hyannis wanted them off the streets. I actually worked with homeless schizophrenics at the time, and they were not welcome to be walking the streets, and yet there was no place for them to go. So one of the good things that happened was that they started to develop clubhouses for people with severe mental illness where they could go during the day. But what changed things in Hyannis was a collaboration between the Main Street Association and the Department of Mental Health. And the Main Street Association began to embrace the people who were at the clubhouse, which was also on Main Street, and to hire them to do jobs in the stores along Main Street. And it was a really good collaboration in it. It created a much healthier climate for downtown Hyannis. But for a while, that homelessness versus the quality of life for people who were not homeless was a big problem. And of course, you see a picture here of someone who probably, I don't know what the history of this picture is, but it looks to me like someone called the police because someone appeared to be a nuisance. And then when there's a resistance to being arrested, and especially if you have a mental health issue, you might start to become assaultive, and then that escalates to a crime, which is the assault on a police officer. So you can see how it can spiral way out of control. And then recently, of course, the whole idea of school resource officers has come up. And Gwen will address this much more than I will. And the zero tolerance police invention started after the Columbine shooting, and the Safe Schools Act brought all of the zero tolerance stuff into the schools, and it kind of blew up recently. And ended up on a viral YouTube where actually a young woman, a young girl who was in the child welfare system, probably, we don't know what happened, but it ended up badly, where it became aggressive. And so people are now really carefully looking at what school resources officers are there to do and what are their rights and responsibilities, and we'll address that further along in this webinar. We all know that the negative interventions by police can have a profound impact on families and children, especially kids with complex trauma who may already be reactive to police because of what has happened in their birth families, will cross that line to a police assault and could be arrested for just standing up to the police when they come into the home due to domestic violence or whatever. And those of you who don't have a background in complex childhood trauma, triggers, police sirens, police lights can trigger a reactive stance for these kids when the stress hormones that surge through their body create that freeze, flight, or fight response. And that's just a reaction to keep themselves safe. The situation can, again, get much worse in a very big hurry, and unfortunately that does happen frequently, especially prior to what Gwen and I will talk about, which is a recent approach to police interventions for people with mental health issues. Not just kids with complex trauma, but kids with any kind of social emotional disability, including being on the spectrum, or anxiety, or depression. These kids all have a problem with self-regulation. They can be triggered easily. They may not understand the body language and intent of police officers, and so they might spin out of control also. And this is what was happening. And we knew that something had to take place in order to de-escalate these situations so that these kids did not get arrested. So the other thing about kids with mental health issues is that they can appear unsafe to themselves and others because they can threaten, they can be suicidal, or they can be cutting. And that may be misinterpreted as not a reactive response or a coping mechanism, but actually appearing to be unsafe. And before crisis intervention teams would come in and try and de-escalate, many of these kids were actually arrested and taken to court. Now, hopefully the response is more to get them help in psychiatric facilities. Older adolescents could be psychotic. We spoke about that as you're entering the time when schizophrenia may start to present itself. You could appear to be very unsafe to yourself or to others. And of course, substance use will also create a situation that could make itself worse, especially when substance uses are involved and a policeman comes and tries to intervene. They always have to make a decision between safety and compassion because they are there to protect ourselves from ourselves and for other people. But when they use deadly force, it can take a significant toll on everyone, including the policemen themselves. So just a little bit of a background about the law enforcement officers themselves. They have become, especially in other parts of the country who do not have a child behavioral health initiative where there's a crisis intervention team that can go out. They are the first responders for mental health crises. And they have to balance compassion against safety. And just for example, in 1998, people with mental illnesses, and this is within the country, this is the national statistics, they were killed at 5.5 times the rate of other population because of the unpredictability of the situation. And the fact that a lot of them may have been acting in a psychotic way and appear to be unsafe. 1/3 of those killed in police shootings in New York City in 1999 were mentally ill. So the statistics go on, 4 times greater than the general public, and that is because, well, there's many reasons for it, and we'll talk about it, was the misunderstanding of mental illness, the lack of training that the police were getting. And this was all statistics from the 90s when things were severely out of control. There's also something called suicide by cop, and that is a very disturbing trend when someone does become very out of control or depressed and wants to die. They will set up a situation where the police will be forced to kill them, to shoot them. And that is a horrible thing to have happen. For the family of the person who is killed, but the police themselves, when they find out it's a suicide by cop, it's very disturbing for everyone. So the good stuff started happening in 1987 when a Memphis police officer killed a mentally ill person. And they created a task force with other local health agencies and the National Alliance on Mental Illness and several universities. They created the Crisis Intervention Team, the CIT, and that was the beginning of it. Gwen will address this a little bit more, but it was the beginning of a huge climate change, a huge paradigm shift for police agencies to relook at what their roles are as the first responders in mental health crises. CITs, it's a community partnership that promotes teamwork and enhances communication, always key, between or among law enforcement, mental health professionals, consumers, and family members. members, consumers meaning those with mental health issues. And each of the team members has an individual responsibility for every event and accountability for the results, which can also include services that are provided by the partners during the intervention. It's proactive. It's meant to prevent tragic situations. They become well-trained, the police officers involved, by a whole bunch of different people with knowledge about the mental health community. They reduce the likelihood of physical confrontations that through immediate responses that are calm and humane. And a lot of training goes into that. And I believe the original model had 40 hours of training. I'm not sure about that, but Gwen will speak to that. So the benefits of the CIT program are that the crisis response is immediate. And this is not CBHI, this is not just for kids, this is for all people with mental health issues. The arrest and use of force is reduced. Underserved consumers, which are generally the people that are homeless, unfortunately, are identified and provided with care. There's collaboration and commitment. And officers are looked at very differently than they used to be as people that were potentially lethal to people in the mental health community. One of my favorite parts about the CIT training is that they actually spend time with individuals who are homeless or who are going to day programs to get firsthand knowledge about what it means to be living with mental illness, so that that humanity and that empathy is introduced to all relationships with them. So as this rolled out over the last, 30 years now, police departments throughout the country have developed their own model. Some of them not as intensively trained as CIT. And so I've just talked about a few of them here. This is one of the models that they use here, and I know, for example, in Cambridge, that some of the police employees are trained as social workers. Civilian social workers will go with the team of people who are intervening with mental health issues. They wear street clothes, so they're not, they don't trigger people who may be triggered by uniforms. They don't carry weapons, and they don't make arrests. They just go along as consultants, so to speak. CBHI is one of the ones where, one of the models where mental health workers are second responders. So what that means is after the intervention becomes necessary, it's been identified as being a situation that intervening is going to be necessary. They are contacted and they will come and help the police or act with the police, and they can help with transporting and referrals. Community mental health officers are police officers and second responders who will follow up with medication adherence and maintain close contact with emergency rooms and hospitals. I'm not sure Massachusetts has any of those. That's a pretty evolved model and takes a bit of money, but certainly very effective, especially when the police community health officers go to court with the people if they are arrested, and can actively participate in the services that are provided. And that leads to the drug and mental health courts that are now being rolled out. Both of those are being rolled out in Massachusetts, and they provide intensive community-based treatment and supervision, not for major offenses, which we still are trying to figure out how to work with those. But the judge then becomes involved in monitoring treatment compliance. And I don't know if that's a good thing, but that's what happens. And someone other than the person who has been arrested themselves is helping to support treatment. And I think at this point I'm going to turn it over to Gwen. Gwen is going to also talk a little bit about her efforts in the past around all of this.
Okay.
Thank you for being here, Gwen.
Oh, you're welcome. Thank you, Janie. are we going to address the questions at,
Let me
at this
just
point?
see here if the questions are anything that they need to know about before the end here. Okay, these are things that we can wait till the end about. Okay, it's not any clarification, so you can go ahead.
Okay. Hello, I'm Gwen Healey. I want to first give you a little bit of information about my history in working with police and with law enforcement. Back in 2000, I co-authored the Police Pocket Guide, Responding to Youth with Mental Health Disorders, with Janet Hirschhorn, who was a pediatric nurse. We, at the time, were participating in a parent support group for parents who have children with mental health needs, and it had come to our attention that there were no resources for police officers that were specifically talking about youth with mental health needs. We looked on the internet, which, believe it or not, in 2016 was not that extensive, or in 2000 was not that extensive. It's only been 16 years, but things have really changed. So we worked with the Department of Mental Health, the Massachusetts Department of Mental Health, and developed this resource with guidance from law enforcement, teachers, doctors, a variety of people, and developed and produced and distributed that resource with the help of the Massachusetts Chiefs of Police Association. That resource has since been modified. It's been updated a few times, and it can be found on the Parent Professional Advocacy League, PAL, website at ppal.net, and can be downloaded there. It is still a valid resource. It was distributed through the internet, and actually across the hemisphere we got calls from many places, including as far away as Samoa, and it became the basis for legislation in different places, policy and practice change, but as well as legislation, and develop, and eventually was recognized by SAMHSA, the Substance Abuse and Mental Health Association or Administration, the federal agency, as a Excellence in Community Collaboration Award. So it has quite a history, and I'm quite proud of it. That is a resource that's still out there for families to view and also for police officers. So I'm going to talk about strategies for families. So first things first, when you start to think about collaborating with law enforcement and why you might want to do that on behalf of your child, you'll need to do a survey of your own attitudes and beliefs. So what do you feel about police officers? What does your child feel about police officers? Do you have any relationships with officers in your community, or with, do you have a police officer in your family? What do your children, how do your children see you interacting with police officers? It's, that attitude is something you're going to need to think of first. And then, why would you want to collaborate with police officers? What are the pros and cons? How will it work? And how does your child feel about it? Depending on your child's age, that could be very significant. Your attitude and your behavior toward law enforcement shapes how your child feels. So, are you interacting with police on the street with greetings, hello, in a friendly way? Do you see them on the corner and say hello? Or do you see them in the rearview mirror and mutter to yourself something that's perhaps unflattering? That attitude is really going to affect how your child feels. So an honest look at yourself and a chat with your child about how they view police officers is a good place to start. You want to help your child understand what police officers do, what are their responsibilities, and here I've listed their responsibilities. They respond to crimes in progress. They respond to emergency situations and reports of crimes. But that's only part of it. They also assist in crime prevention, and a big part of what officers do is they educate citizens. They provide guidance, and they offer a helping hand. So talk to your child about your plan to collaborate with your local police if that's what you're deciding to do. Involve your entire family so that everyone's aware and on board, and incorporate their thoughts into developing your plan. So before you make a phone call to the chief of police and say, I want to talk about my child who has special needs and how the police department and I can collaborate for potential future incidents or occurrences, put some thought into developing a plan. If it's appropriate, you might want to inform extended family, neighbors, and caregivers about having a plan with your local police department. So think about what your child might do that would initiate police involvement. Do you have a child who is prone to wandering or bolting, running away? Do you have a child who has behavioral health issues, has outbursts or behavioral challenges? Do these happen at home? Do they happen in public? Think about the reasons that you would need to collaborate with your police department. And what do you hope to achieve? Are your expectations reasonable? Police officers have specific duties. Are you thinking that you can call a police officer every time that your child, you want your child to behave differently? That's not realistic. So a self-assessment here is very important. So make a list of potential incidents in the police response you would prefer. What might happen, and then what would you want to happen? So how can the police support your family and support your child in a way that is not only appropriate but effective and can lead to a positive outcome, because that's our goal overall, is a positive outcome. What other ways might the police respond other than a positive, that would be something other than a positive outcome? How would you want to make sure that that doesn't happen? Do you want your school, your child's school, to be part of the plan that you put together? Are there others that should be participating, your child's therapist perhaps? And is there a school-based behavior plan that you want to consider making your local police department aware of? So the things that that your child might do are the things that you need to think about as you put together a plan. Of particular importance is, does your child's school have a school resource officer? Janie talked about school resource officers briefly before. This is a growing trend and in my experience, a very positive trend. Police officers who are, whose job is to be stationed in their school or their school district, moving between schools. And they have responsibilities of all police officers, with perhaps more focus on the education and the counseling part of what police officers do. Here we have a picture of a, looks like a school staff person and their school resource officer. They look like they're on pretty good terms, and that's the way that ideally it will be. That picture that we saw previously of the school resource officer who had the altercation with the young woman, that was not what school resource officers are there for. It's not what their responsibilities are, and hopefully we'll see very few of those kinds of incidences. This one is much more typical of what we're seeing. So, school resource officer provides informal counsel to students and to parents and to school staff. They educate on topics related to law enforcement and civic responsibility. School resource officers will go into the classroom and give a talk or read to younger classes about about being a responsible citizen, about what it means to participate in your community. And you know, they may, for older kids, talk about their responsibilities to each other, to their peers, to their community. There are any number of things that, that they can teach about, and that is a very big part of what school resource officers do. They also will talk about and participate in prevention, crime prevention, teaching kids how to be safe, how to protect themselves, how to not get into trouble, and to help their friends not get into trouble as well. A school resource officer is not there to enforce the school's code of conduct. The school's code of conduct is something that your child needs to adhere to, but that's the responsibility of the school personnel, not the school resource officer. They are police officers, and they're there for those activities related to policing, not to enforcing school code of conduct. So I want to go back to the that picture we saw about the South Carolina school resource officer who had come into the classroom because a student was not responsive to the teacher. That would be a school conduct issue. That's not a law enforcement issue, and it really was an improper use of the school resource officer. Law enforcement officers are sworn to serve and protect. That's what they do. And it's not the responsibility of the school resource officer in your community, or any officer in your community, to be a disciplinarian for any child. So that's something that's very important to keep in mind. All right. Once you've given some thought to putting together a plan and talking to your local police department about your child, you will need to gather information that you'll be taking to the police department. You'll want a current picture of your child. I talked with a friend of mine who is a police officer, who is a school resource officer. He says that it's very important to have a picture of your child and to update that regularly as your child grows. He told me that when they get some new information, a parent reaches out to the local police department where he works. That information is discussed at the morning roll call meeting. They talk about this child, this family, the child's needs. Everyone looks at the picture, and then everyone, all the police officers in the community are aware that this child may come to their attention in time. If you have a child that you feel may come to the attention of your local police department, this is the kind of intervention that can be a very positive thing for you. So you want to gather the information to present to your police department. Definitely the picture, a current picture, and update that regularly. You want to provide details, not only a description of your child, their height and their weight and their name, any significant physical characteristics, but you want to make sure that the police have other information that is relevant to your child. So the family names, the names and ages of their siblings, phone contacts, of course, the school that your child attends and their teacher's name, their grade, any other relevant information the police may be able to quickly access and use to, as they interact with your child, should the need arise. Oftentimes, a department will have a specific form that they want you to fill out. That's fine. Make sure that you have all of that information that they're going to request of you with you when you actually make the appointment to talk to your police department. They'll want to know about your child's condition, their medical diagnosis, or their behaviors, whatever it is that your concerns are that you want to bring to them. Include your child's diagnosis and, if appropriate, medication list if your child takes medications, if they may be off medications. This may be especially important if you have an adolescent whose medication compliance is complicated. So that may be something that you want to include. It depends upon your own individual circumstance, what you want to share with the police. But it is private information. It is not something that is shared or that is accessible to the general public. So, and that's something you can also talk about with your chief of police when you actually sit down to discuss collaborating with them. Make sure that you are clear that about your concerns, so that police know what to anticipate. I'm concerned that my child may wander. I'm concerned that my child may have a behavioral outburst. I'm concerned that my child may inadvertently vandalize something or act out in public because he doesn't understand social norms, whatever your concerns are. All right, so once you've considered your goals and you've made a plan, you've gathered information from your child, from your family members, then you're ready to contact your local police chief. If you don't live in a small community, or if you do live in a small community, it will be a local police chief that you'll want to reach out to. If you're in a city, you might want to talk to your precinct captain or a juvenile officer. You can simply call your local business number. Don't call the emergency number. Call the local business number of your police department and let them know what you want to do and ask to make an appointment, and they'll guide you to the appropriate individual to go and sit down with. So you'll phone the police department. You'll want to schedule a 20 to 30 minute appointment to talk about your child who has special needs. Make sure that you tell them that it's to talk about your child who has special needs and how you can work together for the benefit of everyone. Oh, resources. Do we want to go to resources, or
we can? Yeah, we are. Some questions are coming in, Gwen. So I think the resource, I did send out the PDF of the PowerPoint to everyone that has registered. So they won't be live. Obviously hyperlinks, but these are places that we have actually gathered our information from, and there's the Pocket Police Guide there from PPAL. The CIT Center is the original crisis intervention team model, and Gwen is actually very familiar with that. And Gwen is available. She's here if you have any questions. But let's just talk a little bit about some of the thoughts that have come through. One of the things that I think people we want to clarify is the SROs are police officers within the school, but things happen outside of school. So the two ways to get that information to either the school or to the police in your town. Now, you had showed me last night a 911 form. Was that you? That was you, Renee. So that's a standard form, right, that all police use in Massachusetts. It's very brief, but it was good. And I guess if you call the police, they will actually, or it's online. It's online. Okay. So we don't. I did not put it on the resource list, and I am sorry. She's going to put it up on the questions part. Another person sent in a link to a form that you can use to bring to your local police department. Now, what I know about are the crisis teams safety plans, which if anybody is in CBHI has to have one of those, and that I believe, it's been a while, is shared with it's shared with whomever the family wants to share it with, but the schools is an important place where that kind of information should be shared. Obviously shared with the SRO and possibly with the local police. That's much more extensive. Their crisis plan and their safety plan has a lot more on it. But there are forms out there that will guide you to telling people what the issues are for your kids. So one of the people that are in attendance talked about a Be Safe program. Have you heard of that, Gwen? It's an actual program where people, I guess they, police come to it. Let me just see here.
Is that the one from Norwood?
Could be. It's on the South Shore. And it's to have the local police develop rapport, especially for kids on the spectrum, I believe. But it would be any kid with a mental health issue. The person that wrote the note said that the police got a real eye-opener about what these kids are about. And it was an excellent program. Doesn't look like it was a school-based program. But if I'm wrong, Lori, just let me know. Was it a school-based program? And she's saying it's, hold on, just scroll down here. I apologize. Oops. One of the other questions that came in was a little bit more troubling is, what if you have an SRO, a school resource officer, whose intervention does lead to an arrest? That can happen, especially if they're being asked to help enforce a code of conduct issue. And this was in particular about somebody who walked out of or I don't know what happened, but they were supposed to be at in the principal's office or something, and they left the school. And so the police officer went after them and arrested them, the SRO. And what do you do? What do you do about that? So maybe you can address that. It's not an easy question. Yeah.
Well, that sounds to me like that was probably not an appropriate use of the SRO.
Yeah.
I don't think truancy is arrestable. I think that's a status offense.
But there's a problem with status offense.
Yes, who knows what actually occurred.
Yeah.
If a child or adolescent assaults a police officer, that is assault, and they can be arrested. Typically, skipping school or walking out of school is not something that you can be arrested for or should be arrested for, or your child. But it's hard to know without knowing the exact circumstances.
Right. And somebody did write in and said that they're confused, and I'll read what they said, because it does not the SRO's job does not include enforcing the school's code of conduct.
Correct.
But you spoke about informing the SRO about your child's challenging behavior, and if the code of conduct includes behavioral outbursts, for example, wouldn't that be part of the SRO's job to handle the situation? So I think what we're talking about here is when a child crosses the line from disciplinary action to actually assault on another child, or assault and battery on a staff member, even though they may be on a behavioral intervention plan or an IEP. What is the job of the SRO in those cases?
Well, if it does become an assault, then it would be the school resource officer's job to intervene as a police officer. Up until that point, before it's an assault, or perhaps that line is cloudy, it would be the responsibility of the school personnel to respond with by putting the child's behavioral plan into place, and intervening in the way that they would as a school as school staff. It can be. But once something becomes a crime, then it is a police matter. But typically, that's not what school resource officers are doing. The school resource officers that I'm familiar with are a very positive influence in their communities, in their schools. They help to build positive relationships with the students. They offer guidance and encouragement, and kids can go to them with questions or concerns about any number of things. Talk about if they're being bullied, or if they think their friend might be getting into trouble, or they've seen something in the community that bothers them, or any number of things. And the school resource officers are there to provide that informal guidance and encouragement and information. And then they also respond to crimes and do preventive work as well.
And I think the problem is that challenging behaviors are becoming more, in some schools, more prevalent, especially in alternative schools. And there is a line that can be crossed, and schools kind of are struggling with this. How do you de-escalate a person, especially an older child who has a mental health issue or has complex trauma, without getting police involved, without assault and battery being the outcome? And we are working on that. We don't really know the best solution to a lot of these interventions, and I think calling the SRO is kind of a default, or not. It shouldn't be a default, but I think sometimes it is, because they have the power to make it stop, so to speak. But it does come up against IEPs. Sometimes, or behavior intervention plans. I don't have the answer, but it's something that we all should be discussing in our schools. What exactly is the role of the SRO? They were originally in place to prevent shootings back in the day, and you know, statistically, I know that there's not been a lot of research about whether or not they have been effective in stopping that kind of thing in schools. But you know, again, it's a relatively new area of research. But a lot of people are talking about this Be Safe program. And apparently it's not a school program, it's a neighborhood program. But it's for everyone. I guess it's a great way to collaborate for kids, for police officers to begin to understand about disabilities and kids on the spectrum and stuff like that. Mm-hmm. It says that schools, families, and organizations can use Be Safe. SROs can use them to teach students with disabilities to collaborate or cooperate with police or to ask for help. Let's see. What can be expected? This is another tough question. What can be expected when a police officer is called to a home after your safety plan has been implemented, but the child is still being unsafe and being physically aggressive or property destruction? That's very close to home for me. Mm-hmm. And I honestly will tell you that the result was usually an arrest. Especially if there was an aggressive type of behavior going on. I know one of the things they used to say is the property destruction over $200. I don't know if that's a minimum for arrest or what, but it became very difficult because the kids were obviously out of control, but we didn't want it to end. We just needed help. But at that time, this was in the early 90s, the police didn't have the strategies to help. So do you have any thoughts on that, Gwen? CIT, yeah, CIT model would be very different. This was before CIT. They would probably have brought a social worker with them, someone who was trained in de-escalation. But the prevalence of CIT in Massachusetts is not great yet.
No, yeah, it's not.
So just be aware of that. That's a model. That is not what's actually in most towns. I have a list of towns that are using CITs or some version of CIT, but it's very few towns. I think it's about 30.
Oh, that's actually
more than you thought. Yes,
it is.
Cambridge is, Boston does, Somerville does for around here. I don't know about the other towns that are farther out.
Egremont on the New York border.
Egremont, that's right. That was one of them.
Small town next to Great Barrington.
Yes. Yeah.
I do have some thoughts about police training. Mm-hmm. I think it is much better, mm-hmm. Or much more comprehensive now, related to interacting with children and youth who have behavioral health challenges, because so often the police are the default call. Parents don't know what to do.
First responders.
And so,
Yep.
exactly, first responders and prior to, well, 20 years ago, 30 years ago, police simply were not trained
Right.
To know how to de-escalate these situations, or weren't trained anyway specifically to address situations involving children and youth. Now they are. It's part of every training, every police officer's initial training, and also it's certainly is part of ongoing training. A police officer once told me that every officer is a juvenile officer because most of their interactions are with juveniles. I think that's more so with perhaps with suburban towns than the city, but so police officers, I think, are much more skilled at interacting with youth and children, and very skilled at de-escalation techniques. Think about what police officers do when they enter a situation. Typically, they take charge. Sometimes with kids with behavioral health challenges, or perhaps kids on the spectrum, taking charge is exactly the opposite thing of what should be done, because their reactions are so significant.
And I think that the poor, I can see some of the people that are writing in here are kind of frustrated, or not frustrated, but desperate to get somebody to help them when the kids are so out of control. And my thought is really to, I think collaboration with the police is the best thing, and to maybe suggest this great training here, especially for kids on the spectrum. Experience autism, which I guess is a training for, which is not unlike the NAMI training to experience schizophrenia. So it's kind of a family training type of thing, so that other people can understand what it's like to be on the spectrum, or what it's like to be psychotic. But I think that the training programs hopefully will become more prevalent everywhere, and that's kind of why we called Let's Look Towards the Future, and to have parents and families become more active in getting this training for their police officers.
I would encourage families to reach out to their police department. Yes. A conversation is a good start.
Yep.
And go from there. Depending upon what your needs are, interventions will be, will vary.
We're just about out of time. I just want to mention that there's a little plug for our program's annual conference, Making a Difference. It's going to be on November 15th this year, and one of our speakers, or might be a couple of speakers, will be from the Cambridge Police Department, and they have told us that they would love to come and offer a workshop on the CIT model that they are using. So there's more coming up, and just watch for more details. And Gwen, again, thank you so much for joining us, and thank you everyone for attending, and we'll see you next month.